Here we go. Hello, and thank you for watching this program on the best rehab codes. There's no audio taping or videotaping allowed, in any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information contained in this presentation is for educational purposes. It's not supposed to be a substitute for your thorough clinical decision making. It should not be construed as any written policy for any federal agency. It's not intended to be legal advice. We don't provide legal services. If we talk about CPT codes, just want to remind you that's a registered trademark of the AMA. Every attempt has been made certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Just a little bit about myself before we get started. My name is Dr. Marty Kotlar. I'm a chiropractor. I'm also certified in CPT coding. I'm a certified professional compliance officer. I'm the president of Target Coding. I practiced for 16 years before I started Target Coding. I'm the founder and CEO of the company. I started it about 12 years ago, and we've been helping thousands of chiropractors over the last 12 years with billing, coding, documentation, compliance. My areas of expertise include HIPAA compliance documentation, Medicare compliant cash plans, and CPT ICD-10 code pairing. I've written many books on billing and coding. I've created quite a few training manuals. I write articles for Chiropractic Economics and Dynamic Chiropractic. I'm a featured speaker for the Coding Institute, Parker Seminars, and Foot Levelers. Plus, I'm a guest speaker at many state association conventions nationwide. All right, here we go. So we're going to talk about the best rehab codes, also known as therapeutic procedures. So let me go through the definition of what therapeutic procedures are before we get started. So therapeutic procedures. This is a manner of effecting change through the application of clinical skills. Application of clinical skills, that's important. I'm going to be covering that in a few minutes, but that's something that some people don't really pay attention to, but it could be the basis, the foundation of these procedures, and it could prevent audits. One-on-one patient contact is required. One or more areas each 15 minutes. So those are the key fundamental items that you have to be aware of before you do any therapeutic procedure. You have to apply clinical skills. If you're not applying clinical skills, it could be considered a service that's not medically necessary. One-on-one patient contact is required. So in some states, staff members can be with the patient. If not, the doctor needs to be with the patient the entire time. You can be with the patient for 5 minutes, walk away for 5 minutes, come back for another 5 minutes. The patient may have been exercising in that scenario for 15 minutes, but only 10 would count. And therapeutic procedure codes can be billed in units. So application of clinical skills is important because, as I just mentioned, it leads to a service being medically necessary or not medically necessary. So I just want to touch on that. Medically necessary versus not medically necessary services. So medically necessary equates to a service being insurance payable. Just think about it. Doctors, when you or a staff member call to verify coverage, or a patient might call to find out what type of coverage they have. If there's coverage, it basically turns into, yes, chiropractic care is covered as long as it's medically necessary. Some patients will call certain insurance companies and they'll say, oh yeah, chiropractic is covered, unlimited care as long as it's medically necessary. If it's not medically necessary, insurance doesn't pay for it. So medically necessary means insurance payable. Chiropractic wellness care, maintenance care, nope, that's not medically necessary, so that's not insurance payable. It may be clinically indicated or chiropractically necessary, but it's not payable. Active treatment under the Medicare rules, that's considered payable and medically necessary. When a patient has pain, restricted motion, decreased ADLs, that's insurance payable. When a patient gets to the point where they have very little pain, range of motion is pretty good, the patient could do most of their activities of daily living, that means it's not insurance payable. Not medically necessary, not insurance payable. Performance enhancing care, What does that mean? Sure, you could have a patient come in. I have this happen all the time. Dr. Kotlar, I'm a golfer. I hit the ball when I tee off 200 yards. I've heard that you're really good at, correcting biomechanical or structural problems in the pelvis, and I have a few friends of mine that have come here and now they're hitting the ball further than they've ever hit the ball before. So I'd like to come to you. Can you get me to hit the ball 225 yards? Sure, come on in. That's not payable by insurance. That's performance enhancing care. So the goal is to get the patient to maximum therapeutic benefit and then transfer them to cash. I would think that's your goal. That's what I hear all the time from doctors all over the country. Cash. I want more cash. I want more cash. Great. Can't argue with that. So if you're going to deal with insurance, then the goal is to get them to off insurance as quickly as possible. For some of you, that may be the goal. Now, who can deliver the services? Also very important. There's a difference between a QHP, a qualified healthcare professional, and a clinical staff member. So a qualified healthcare professional is an individual who is educated, who is qualified by training and education and license, that performs a service that can be reported, independently reported to an insurance company for payment. So an example of a qualified healthcare professional is chiropractor, medical doctor, osteopath, nurse practitioner, physician assistant, physical therapist. A clinical staff member is a person who works under the supervision of a qualified healthcare professional who is allowed by law to perform or assist with certain procedures but cannot individually report that procedure. Example, in many states, chiropractic assistants can perform services like traction and ultrasound and oversee therapeutic exercises and therapeutic procedures. However, that cannot be billed under the CA's name. There's no NPI number for the CA. So there's a difference. Now let's talk about the first one here. Therapeutic exercises, 97110. Therapeutic exercises are used to develop strength, endurance, range of motion, and flexibility. You may want to write this down. The acronym SERF, S-E-R-F. S stands for strength, E stands for endurance, R stands for range of motion, and F stands for flexibility. So your goal is to improve one of those parameters. It could be performed either an active assisted, or passive approach. What does that mean? Passive means you're actually stretching the patient to increase range of motion and flexibility. Active means they're running on a treadmill, they're doing abdominal crunches, they're lifting weights, tubing, balls, bands, or it could be a combination. Most of my clients do a little combo. They'll do about 5, 6, 7 minutes of stretching, hands-on, and then they'll have the patient do an active procedure. So it's a little combination. So if you're going to bill for therapeutic exercises with the purpose of increasing range of motion, which is probably the most common reason or intended outcome, then what should the patient have a lack of when they come in? Yes, you got it, range of motion. It's got to make sense. You have to have a clinical rationale for everything you do. That's what the insurance companies say. That's what the state boards say. That's what your malpractice insurance company will say. And that's what I teach. I teach how to protect my clients from malpractice, risk management. Many times I'm teaching doctors how to do things to prevent state board issues. For example, in certain states you can't do prepays. I have some clients, they're doing prepays of $3,000, $4,000, $5,000, $6,000, and they didn't realize their state law doesn't allow that. So that's part of my training, that's part of what I teach, and of course maximizing reimbursement from insurance and cash patients. So with therapeutic exercises, it's a great service, but you got to be able to prove that it's needed. So if you're billing for 97110, and then I would look at your notes and you're telling me, well, I do 97110 to improve range of motion. If I look in your notes and it shows range of motion is normal, or you didn't even do range of motion, you see how that can cause an insurance company could say, oh, we're not paying for that because the care is not medically necessary. Next, 97112, neuromuscular reeducation for movement, improving balance, coordination, proprioception. Now I know there are some insurance companies that will say, oh, you could only use this code for some sort of advanced neuromusculoskeletal disorder like like multiple sclerosis or something like that. Yeah, if that's the insurance company's policy, then you should abide by it. Whether you're in network or out of network, you should abide by that policy because the claim's not going to get paid if you're treating the patient for a sprained ankle. With some other insurance companies will say, hey, the patient has a sprained ankle, and you want to put him on a balance board to increase proprioception from the ankle up to the brain, they'll pay for that. So that's going to be up to you to decide whether to use this service. Many chiropractors are afraid to use this code. Okay, that's a personal decision. That's a personal business decision you have to make. I know many chiropractors using this code. I know many physical therapists using this code. Getting paid, no problem, after an audit. You see, that's another thing. When I speak to doctors and I go, Doc, you sure that's the right code? Well, they're paying me. Well, getting paid doesn't necessarily mean that you did the service right. Ask any chiropractor that's had to give back $3,000, $4,000, $5,000, maybe $50,000 or $100,000 to an insurance company. I always hear that when I'm dealing with doctors that are in audits. They go, Marty, I've been asked back for $20,000 by an insurance company. I thought I was doing everything right. They were paying me, so I thought I was doing everything right. You see how that could be deceiving? So 97112, if you're going to use it to improve balance, coordination, great. What should the patient have a lack of? What should your documentation show? Yeah, that the patient has some sort of lack of balance, coordination, proprioception. And then we have manual therapy techniques. 97140. Very commonly reported, billed, used by chiropractors and physical therapists. And this therapy includes mobilization, joint mobilization, soft tissue mobilization, manual traction, manual lymphatic drainage, manipulation. Some of the problems with this code is that there's a CCI edit. That means Correct Coding Initiative edit. So the edits state that manual therapy and a chiropractic adjustment performed in the same anatomic site is a duplication of services. I don't agree with that. It doesn't make sense to me, but I don't make the rules. I just help you understand them. And you got to know the rules, right, in order to know if you're breaking them or following them. So that's what I teach on a regular basis, the rules, the guidelines, the laws, to make sure that, although we're not a legal firm, we teach the scope of practice laws to our clients. So if you're going to do manual therapy, let's say in the lumbar region, and the patient also has a cervical problem, so you're going to be adjusting the cervical region, manual therapy in the lumbar region, you should put modifier 59 on the 97140. Now there's something called code pairing. I look at it like, like pairing food and wine. It's one of my favorite things to do is go to food and wine festivals. I enjoy learning about how this combination works and how to maximize the experience. So I look at food and wine pairing just like CPT and ICD-10 code pairing. CPT diagnosis code pairing. So for example, if you're going to bill for 97110, that code, therapeutic exercise, that pairs beautifully with sciatica, neck pain, shoulder stiffness, a quadriceps strain. Think about it. A patient comes in and says, Dr. Kotlar, I was playing tennis, and after tennis, my shoulder is really stiff. I could hardly move it. Okay, we're going to do therapeutic exercises to increase motion. You see how that pairs nicely? And if you're going to use, I don't know, many chiropractors, many of my clients use traction, mechanical traction. That pairs beautifully with a cervical disc problem, lumbar disc degeneration, neuromuscular reeducation. Sure, if you're trying to improve balance and coordination, the patient might have dizziness. They might have R2681, unsteadiness on feet, lumbar radiculopathy, even sprained ligaments, sprained ankles. Manual therapy, myofascial release. Sure, that pairs beautifully with myofascial pain syndrome or bursitis of the hip. And we have one more here, therapeutic activities. Therapeutic activities is Another therapeutic procedure, and I get that question a lot, Dr. Kotlar, what's the difference between therapeutic exercises and therapeutic activities? Well, we went through therapeutic exercises. Therapeutic activities is directly related to a specific activity. A lot of people call 97530 the ING code, because whatever you're doing with the patient, it must relate to improving bending, lifting, reaching, carrying, throwing, and it's a multi-parameter code. So you have to do more, but it pays more. It has the highest RVU out of the most common therapeutic procedure codes. So therapeutic activities, sure, that pairs beautifully with a frozen shoulder or also known as adhesive capsulitis or back pain or stenosis. So you need to be able to justify every CPT code you use with the proper clinical rationale and be able to justify, oh, your ICD-10 codes. Here, let me just expand on that a little bit. Your diagnosis codes all need to make sense. So for example, let's say you're going to diagnose a patient with some sort of SI joint problem like a SI joint subluxation, sacroiliitis, or sacroiliac joint sprain. You should see that on your screen right now. So sacroiliac sprain, S33.6. So if you diagnose a patient with a sacroiliac joint problem, and now you're questioned either by a state board, and you know a cash patient can sue you, right? A cash patient can sue you. So you need to be able to justify everything you do. You could have a patient file a complaint with the state board. The board will ask you for your notes. Again, you want to be able to justify everything you do, and of course an insurance company could say, hey, Dr. Kotlar, we see that you diagnosed the patient with sacroiliac joint sprain. Can you explain to us, how did you come up with that? So hopefully you'll have a good answer like this. Well, the patient had pain in the SI joint. I did some orthopedic tests like Yeomans and Ganslins or for Bear-Patrick, so do some of these ortho tests. It shows competency. It shows that you're being thorough. I know some chiropractors that they're more subluxation based. They go, Marty, I don't use a reflex hammer. I don't check blood pressure. I don't do ortho or neuro tests. I respect chiropractors. That's what they do. That's what they feel works best for them. However, if there's a malpractice case and you say, well, I diagnosed the patient with a sacroiliac joint or cervical radiculopathy, but I didn't do any tests to justify it, you see how that could look unusual. You don't want to look unusual. You want to be able to prove everything you're doing. So here, I mentioned cervical radiculopathy. If you diagnose a patient with cervical radiculopathy and you're questioned, hey, Dr. Kotlar, how did you come up with that? Hopefully you'll say, well, the patient had pain in the neck radiating into an arm. I did some ortho tests like Sperling or Jackson compression or Valsalva. You don't have to do all of them, a couple of them. I checked reflexes. I checked for myotomal weakness. There was some diminished reflexes, limited range of motion, subluxation. Took x-rays. That's how you can justify it. So it's a good thing to do. Oh, here's an excerpt from a book that I recommend that gives you a whole bunch of diagnosis codes and all the subjective findings, ortho, neuro, chiro, and suggested imaging to help justify the diagnosis code you come up with. This is an excerpt out of the page out of the book. You see, like for cervical brachial syndrome, also common, do Wright's, do Atson's. The patient's probably going to have some forward head posture, maybe thoracic kyphosis, rounded shoulders. That should all be part in your exam, which will help you diagnose or justify the diagnosis. Oh, okay, here's, I have an expanded description here of 97530. So therapeutic activities, direct one-on-one patient contact required. It's the use of dynamic activities to improve functional performance. So you need to use dynamic activities. A patient lying on the floor doing abdominal crunches on a gym mat, is that considered a dynamic activity to improve functional performance? Probably not. So yeah, I mentioned you have to show that you're improving bending, lifting, reaching, carrying. It should be part of a treatment plan directed at a specific outcome. You have to document clear correlation between the type of therapeutic activity being performed and the patient's underlying condition. We're just about done, so try and get your questions in if you have any. Okay, now let's talk about time descriptions and unit billing. And there's two schools of thought. There's total time versus rule of 8. Now you may have been heard these described differently or titles differently, so let me just share with you how I recommend you look at it. So according to Medicare and United Healthcare, total time is based on units reporting. So total time of 8 to 22 minutes is 1 unit. 23 to 37, 2 units. 38 to 52, 3 units. 53 minutes to 67 minutes, 4 units. So this method requires you to add up all the timed codes that you perform. That's why it's called total time, and then determine how many units or codes to bill. So let me give you an example. For total time, in the top left corner, if you perform 97140 for 23 minutes and follow that with 97110 therapeutic exercises for another 23 minutes, in the total time rule or school of thought, that totals 46 minutes. You could only bill 3 units or 2 codes. At a quick glance, you might say, wait, 23 minutes of 140, 23 minutes of 110, well, I should be able to bill 2 units of each. No, you need to total that up. That totals 46 minutes. 46 minutes falls in between 38 and 52. So you can only bill 3 units. The next total time example, 30 minutes of 97140 plus 23 minutes of 110, that totals 53 minutes. Aha, now I can bill 2 units of each code because I got to that 53rd minute. Now, the rule of 8 approach. 97140 in the bottom right corner, 97140, 8 minutes. And you follow that with another 8 minutes of 97110 for a total of 16 minutes. Some health plans will say that's fine. That's what I call the rule of 8. 8 minutes minimum, followed by another 8 minutes of another code. Then you could bill 1 of each, or 2 units, or both codes. Now, you take that rule of 8, 8 minutes of 140 and 8 minutes of 110, and you apply that to a United Healthcare patient for a total of 16 minutes. You could not bill both codes. You'd only be able to bill 1. 16 minutes falls in between 8 and 22. Any questions on that? Please send them in. All right, now here's another item that I'd like to share with you regarding a care plan versus a SOAP note. A care plan should tell the whole story. You should create a macro, a template, just a couple of clicks of your mouse or forms that you could easily circle, check. This should not take long. This should take probably 10 seconds for you to outline what you're going to be doing for, in this example, therapeutic exercises. And there's a big difference between discussing therapeutic exercises in a care plan and in a SOAP note. So in your care plan, I would recommend you jot down something like this. The initial 12 visits will include therapeutic exercises with direct one-on-one contact to, for example, the lumbar region to increase range of motion. The exercises will be performed and explain your protocol, balls, bands, tubes. So you're telling the entire story right there. And then on each individual SOAP note, all you need to do is say therapeutic exercises, low back, 15 minutes. Big difference. All right, just a few closing comments. Please check with all the carriers you bill prior to submitting claims to ensure that it is compliant. We cannot guarantee that this information will guarantee payment from any insurance company or patient. And Target Coding is not responsible for any insurance company laws, rules, and guidelines that may change following this presentation, and you know they always change. Please stay on top of these changes, attend seminars, webinars, join your national and state professional associations. Here's our contact information. Email is info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. Our HIPAA secure fax number is 1-844-831-2347. We set that up so doctors that need to send us patient records You don't have to white out or black out the patient names. It goes right to our HIPAA secure fax service. Oh, yeah. Now, I mentioned that book that gives you the justifications, the clinical rationale for each ICD-10 code. It's part of this book on the best chiropractic and ICD-10 codes to improve reimbursement. There's some, so there are some excerpts of the book here that I'm sharing with you. As I mentioned, pairing your CPT codes earlier. So here's one page out of the book on how to pair therapeutic exercises with the proper diagnosis codes in the cervical region. That's what you see on the screen here. And then we also have it for the thoracic and lumbar and extremities. And then we also have in the book what I call long-term treatment diagnosis codes, moderate term and short-term. So a short-term treatment diagnosis code would be maybe spasm or muscle strain, and then long-term treatment diagnosis codes, well, those are going to get you paid for more visits, assuming the patient has them in a clinical setting. So we have that. We also have some really good cheat sheets. At a quick glance, you could see which codes pay the most visits. And here's that page again that talks about how to justify the diagnosis code that you use. And we also have a section on in the book on frequently asked questions. I get this all the time. Marty, what's the difference between a disc disorder and a disc displacement? What's the difference between, myalgia, myositis, and myofasciitis? What's the difference between cervical brachial syndrome and cervical radiculitis? What's the difference between radiculitis, radiculopathy, myelopathy? So these are the questions I've gathered over the years. I put them in the book, and it's interesting. I know doctors, in practice 25, 30 years, and they're not sure what's the difference between spasm and contracture. So it's not embarrassing. You just got to learn and grow and be a sponge. Oh, we also offer, for those of you that see Medicare patients, Medicare requires that you have a Medicare compliance manual, that you create policies and procedures specifically for Medicare patients. This is something that's been around for many years, but most chiropractors are not doing it, and it could prevent problems. You could actually find things when you go through this Medicare compliance program. You can find things that you'll improve. It could actually help your practice. It doesn't necessarily have to be a scary thing. But again, according to the federal government, if you see Medicare patients, you are required to have a Medicare policy and procedure manual. And it has a few very important things. But we could help you create one. It doesn't take long. It's about 30, 35 pages. It's not a big deal. It takes a couple of phone conferences with us, and we customize the manual for you. We personalize policies and procedures for your practice. We give you chart audit tools. So here's an example. Medicare requires that you do an audit of, maybe 2, 3, 4 patient files a couple of times a year. How are you going to do a self-audit? It's like before you're going out to a party, you look at yourself in the mirror, you do a little spot check on your hair, your makeup, whatever. Same thing. Take a look at your charts. Before you're going to send them out to everybody, make sure, you got everything looking nice and pretty. So we give you this little checklist. Oh, we also offer HIPAA compliance, which is, again, mandatory. It's not a suggestion. It's required. You can get a knock on the door, or you can have a staff member, a disgruntled staff member, which is one of the most common things I see in chiropractic practice, which puts a threat to the practice. A disgruntled staff member either steals information or contacts HIPAA and says, oh, the doctor is violating HIPAA. So you want to be able to protect yourself. If somebody comes knocking on your door, the HIPAA police say, hey, we have a complaint by a staff member or a patient. Can you show us your policy on passwords, how you create your passwords and how you train your staff members on passwords? Can you show us your policy on what you do when you fire an employee or when they resign or leave? Could we see that one? So these are the things you need to protect patient health information. I look at HIPAA compliance like sitting in traffic. It's something that you really don't want to do. It's something that's annoying, but it's part of life. HIPAA is part of life, so make sure, you just want to be able to SWAN, right? What's SWAN? SWAN is an acronym for Sleep Well at Night. If you see Medicare patients, get a Medicare compliance manual. You know what's funny? The doctors that are doing this with me and probably with other companies are the most successful practices because they use it, to protect their practice. Many people, get life insurance because they want to protect their family just in case something happens. Many people get extra insurance on their car because, hey, just in case something happens. It's a smart thing to do. Well, to me, this is a smart thing to do. And I could tell you, if you are using a billing company, and those of you listening to this presentation, if you're using a billing company, ask your billing company if they've gone through a full HIPAA compliant program. Because if they have vulnerabilities, if somebody could hack into their system and breach their system, then they can get into yours. So you want to deal with, it's just like if you work with a bank and you put stuff in their safety deposit box, you're assuming that they're going to protect that. If you use a bank that has a safety deposit box but they keep all the boxes open, oh boy, there's a chance your stuff can get stolen. So if you're working with a billing company, find out if they're HIPAA compliant. If they're not, refer them to us so we could help you get protected. So we work with many billing companies in getting them HIPAA compliant. We also offer seminars and webinars. We have memberships that those of you that would like to be able to, contact us at any time with any billing, coding, documentation, compliance question. We have this basic membership program, $99 a month, pay as you go. And you could attend all our live seminars. Like later today, we're doing a live seminar on SOAP notes. It's 2 hours, and you get 2 CE credits. If you're a member of Target Coding, you don't have to pay. I think that one costs $129 if you're not a member. If you're a member, there's no charge. So that's one of the benefits. And then we also offer a gold membership, which includes a lot of information. It's a complete review of your codes, your CPT codes, your diagnosis codes. You get the book that I was referring to, training manuals, access to the member-only section of the website, all of our forms and letters. You can get live webinar access, recorded webinar access. And then we also offer something called our Platinum membership, which includes a full day of training at your facility. It's an on-site training program. So again, here's our contact information. I want to thank everybody for attending. I hope you learned a lot.